Welcome back to Studio B. I'm Dr. Stacy Reuille-Dupont. And this month, I thought I'd talk to you a little bit about mental health since it's May, and May is Mental Health Month here in the United States, that it is a really good time to go over what is mental health and why everyone deserves therapy. So here's the deal. Mental health, when you have mental health and wellness, you have the ability to regulate your emotional experience and to respond to the things that are going on around you rather than just react based on old learning, old patterns, or what's going on external to you in the environment, or even sometimes what's going on internally for you. You can step back and say, what is it that I really want to do here? And what will leave me feeling proud of myself when I leave this interaction? Which sometimes, let's be honest, is you actually just leaving the interaction. So that takes a lot of self-awareness, and that is mental wellness, emotional intelligence, and mental health. In order to get there, we all need help and support. We can't do it all by ourselves. Our brains and our nervous systems as mammals are regulated, and they are built off other interactions with other mammals. So when I am trying to help myself be the most healthy I can be, I must be aware of where I begin and where the other person ends. Otherwise, we have these experiences, which in my world we call enmeshment, and codependency might be another word some of you have heard, where we really don't know how to engage without playing off the other. And as a result, what happens is my experience then becomes entangled with someone else's. As a result of that, I may be responding or reacting based on them or the environment around me rather than my true self, my goals, and my goals for whatever is going on around me. So when we have an experience of being able to be mentally well and mentally healthy, I'm going to have that ability for emotional regulation and self-awareness to know what it is that's going on with me and how I want to respond. If you find yourself blaming the other person, saying, you made me mad, or you did this to me, what you may be talking about is impact and influence, which is where something else happens in the environment, and as a result, I have a particular feeling. That particular feeling I have is all about me. It has nothing to do with what the other person did, said, or how they behaved. It has everything to do with how I am reacting to whatever it is that they are doing in the environment around me. So that becomes really, really critical to be able to understand impact and influence. So I can understand when I'm saying and what I'm behaving like is impacting and influencing other people, but that I am not responsible for someone else's emotional experience, their reactions, or their responses. They are. And that can be really, really tricky for a lot of people. And a lot of us grew up in environments where we were told, you made me mad, you made me sad, you made me happy. And as a result, we got some sort of either punishment or reward. And when we find ourselves doing that, we call that projection. When you're saying to somebody, well, you made me mad, what you're really doing is saying, I am mad. As a result of being mad, I need someone to blame because I don't know what to do with this. So we find that it can be really, really toxic when people are unwilling to take ownership of their own anger, sadness, fear, remorse, guilt, humiliation, embarrassment, shame, especially. And then they'll project onto other people saying, you are the problem. Not that I'm having difficulty with this, but you are the problem. And as a result of you doing X, Y, and Z, I'm now impacted. They're not going to be that articulate. It's usually going to come out in some sort of explosive or implosive type behavior or response, passive aggressiveness. It's going to come out in somebody collapsing, somebody exploding, etc. Those are not mentally healthy ways of being in the world. So if you're somebody who is known for projecting onto other people when you're angry, fearful, sad, especially feeling shame, it's a big one people do, then it's time to take a step back and understand what's going on for you. Now, the reason why everybody deserves mental health treatment is because we build our brains and our nervous systems off of other mammals. So what happens is when we have emotional and social wounding, so if you think about having a physical wound, you've got a cut on your arm, it's bleeding, you're going to go to the doctor, you're going to get that stitched up, cleaned out, etc., so you don't have an infection. We have those same things happen to us psychologically, and we all have them. We all have what we call relational traumas throughout our lifetime. Some of us also have event style of traumas, say an assault or loss of a home due to a natural disaster or say fire, something like that, where there's been something to disrupt our sense of safety and well-being in the world. That's the basic definition of trauma, that sense of safety and my ability to engage in healthy ways within the world gets very disrupted. And what happens and what's physically happening to you is your nervous system is going through a restriction. And so your nervous system is becoming more and more narrow and unable to deal with stressors in your environment. You need to reset that and bring that back to homeostasis. So when we have those sorts of wounding, we need a relationship in order to help us heal those and take care of them and reset our nervous systems. So for many of our mental health disorders and illnesses, what we really have is a nervous system that has been struggling, and we have a sense of maybe chemical imbalance as a result of that nervous system difficulty. And we have some sort of trauma in the system where the body and the mind do not feel safe in the world. So we need to come into relationship in order to work through those things and heal them. Now, when you come into therapy, unlike when you just go out with your friends or you just talk to your family members, when you go out for therapy, you're going into an office with somebody who is trained to regulate your nervous system and help you build your brain through different types of processing. In other words, how our brain manages experiences, so that you can grow and expand your neurological base for dealing with things that happen to you in your world. That is not the same as just going out and venting. And in fact, when I have clients who want to just come in and vent repeatedly and they're in an eddy of often interpersonal relationship difficulty or self-implosion difficulty, maybe suicidal thinking or self-harming behaviors, what happens is they're not going to get better. They're going to just keep reinforcing that neurological component that keeps them stuck in the same patterns. So when you go into therapy, the therapist is trained, one, to actively listen. No bias in your decision making. They don't have the same bias maybe your partner, your child, your parent, your friend, your community has in whatever decision you choose to make. They're going to help you look at and discern the best decision and outcome for you given that circumstance. Then they're also trained to help manipulate that, because just like any other muscle system, we need to overload to some degree to help that nervous system tone. Now, overload in that realm is very different than overloading, say, your bicep in a bicep curl by adding some external weights and a dumbbell. However, when we take that nervous system and we ask it to go under a little bit of stress, we increase what's known as our window of tolerance. Our window of tolerance, for some of us, is tiny. And for others of us, it's really big. This is our ability to manage stress before we do what we call in therapy, tip out in layman's terms, or we become hyperactive or underactive in our nervous system state. So what happens in therapy is we're looking at where are the top and bottom edges of your ability to manage stress, your window of tolerance. What are those stressors that really push it? And then we're going to ask you to ride those edges, because as you get more and more work riding the edges, you become better able to tolerate them, which means you're going to expand your window. Just like if you start out with a 10-pound dumbbell, then you move to a 20 and then a 25-pound dumbbell. So what we're doing over time is helping you expand that and build your capacity to deal with emotional and social issues that come up and impact your nervous system. This is how we treat psychological wounding and how over time you get better and more healthy. The more healthy your psychology, the more healthy your physiology. So if you really want to be on your top of your game and the most healthy you can possibly be, you need psychological health. And if you don't have it, you need help. Now, if you are somebody sitting there saying, I don't really need that, this is the way I've always been and it's fine, or this is how everybody is that I know, or that's for other people, hello, projection and blaming right there. If that's for other people to do, and if they just took care of their stuff, then I would be okay. If you're somebody who keeps wondering why the world keeps happening to you, rather than you being able to get what you need and want in the world, then you are absolutely one of those people who needs psychological treatment. And treatment doesn't necessarily mean that anything is wrong, but if you want to evolve and you want to be the best person you can possibly be in your life, then you need to get a coach. You need to get some help, because we cannot do this kind of thing on our own. We are pack creatures, and our limbic system and our nervous systems are built upon relationships. We need relationships to make them the most healthy. And the way that we can get the most healthy is to hire somebody who actually knows what they're doing. So I could get a lot better just listening to my husband tell me about how to play golf, but I'm probably going to be a lot better if I hire somebody who's a professional golfer to coach me in the skills that I specifically need, because he's bigger than me. He plays sports differently than me. He's been playing golf different than me for years. So what I need is somebody who can tailor it to me. So in mental health treatment, I could go talk to my friends, I can talk to my family, I can look in places in my community, but I need somebody who can look at me and my issues and my experiences and tailor the treatment to me. I need a life type coach, somebody who can truly help me heal the psychological wounding I have, help me set my goals and set my track for what I want to accomplish in my life, and then hold me accountable to get there. That takes a lot of skill to be able to hold you within those spaces and know which tools, which tricks are going to actually help you. When I'm personal training people, I cannot personal train them the same way that I work out, because not everybody's body is built like mine. I need to understand their physiology, their body type, their diet, their environment, what's going on with them, and then I need to understand the exercise science enough in order to truly give them the information they need to be the most healthy they can be, not just based on what I can do well. And the same thing goes for psychology, for relationship health, and for making sure that you have a strong and solid nervous system that is capable and able to deal with stress in the world. So as we wrap up May for Mental Health Month, I hope you take my advice and that you are somebody who goes out and gets your mental health treatment, whatever that looks like for you, so that you can be the best version of yourself. If you enjoy this, if you feel like that maybe is you have some questions or ideas about what that could be, you can drop a comment below so that we can know what it is you're thinking and how we can relate to each other. Our community grows and gets better when we all are interacting with each other. If you like these videos, please subscribe so that you can tell me what you would like to hear more of, and I'm happy to make them. I enjoy making them for you. And with all of that, go out and be well today.